Okay, ma'am, can start. Can I think sir will join shortly. Can start.
Okay. So, Namaskaram to all and a very warm welcome to 28th Parva of Prabodhini webinar series. On behalf of the whole team of organizer, Shri Babu Singh Jai Singh Ayurvedic Medical College and Hospital, Farokhabad, this Prabodhini team welcomes you all. So, before starting the scientific session, let us seek the blessings of Lord Dhanvantari. So, we will start with Dhanvantari Vandana.
नमामि धन्वन्तरिम् आदिदेवम् सुरासुरे वन्दित पादपद्मम् लोके जरारुकभयमृत्युनाशम् दादारमीशम् विविधौषधीना धन्वन्तरिं रमानाथम् सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया ॐ शान्ति शान्ति शान्तिः
Om Dhanvantaraye Namaha. So, with all the blessings of Lord Dhanvantari, we all are in a journey of quest to the knowledge with our Prabodhini team. And today we have reached 28th Parva of Prabodhini webinar series. So, before starting this session, I will just revise some of the rules and regulations of Prabodhini webinar. And of course, your participation, all the attendees are coming here. Our guest speaker will also arrive or join us shortly. And I know you all are very eager to have the scientific session, whatever knowledge we are going to share today, whatever thing we are going to learn today, it will be new, it will be exciting for all of you. So, Prabodhini webinar series, they organized by Shri Babu Singh Jai Singh Ayurvedic Medical College and Hospital, Farokhabad, UP. We have started this journey before 2.5 years, and it has been a long time. We all are together. We all know that Ayurveda is the gift of our ancient sages. They have encoded this Ayurveda in the form of shlokas, in the form of formulations, and most difficult, it is in Sanskrit language. We all don't know, most of us don't understand Sanskrit. We all need to understand it. We all need to decode it. So this is our effort to bring all the knowledgeous persons to have you, provide you guides who can guide us in this journey and who can make us understand all these formulations and all these secrets. So with us, our patrons are Dr. Shailendra Yadav, Chairman JS Group, Dr. Sunita Yadav, Ma'am, Director JS Group, and Principal Sir Dr. Manjunath NS from Shri Babu Singh Jai Singh Ayurvedic PG Medical College and Hospital, Farokhabad. We are the organizers of Prabodhini webinar series. Dr. Niharanjan Mahanta, Associate Professor Panchakarma from Sri Sri Narsinghnath Ayurvedic Medical College, Odisha. Dr. Preetimai Sahu, of course, me, Associate Professor Kai Chikitsa from Sri Sri University. And Dr. Sheenas BS, Assistant Professor from Panchakarma Department, Sri Babu Singh Jai Singh Ayurvedic Medical College and Hospital. Farrukhabad. So it is our effort to provide you whatever you want. We can we can share all types of knowledge our guest speakers have with them, their clinical experiences. And in this journey, we have started from 25th April 2023 and completed so many episodes, so many parvas, and we had a lots of knowledgeable people with us who shared their clinical insights. And today we have Dr. T.V. Srini sir, professor and HOD Department of Rashastra Government Ayurveda College, Kerala, who will be sharing low back pain insights from clinical practice. He is a very good practitioner, and of course, he is a very good teacher, very knowledgeable person, and he will be sharing his clinical experiences with you today. So before starting this session, uh, 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 a little I will be keeping on rules and regulations. Registration is mandatory. Registration is done through filling the Zoom forms provided in the link. After filling in the Zoom forms, you have to join the WhatsApp group Prabodhini through the link provided, as all the further proceedings will be intimated in the group. On successful submission of the form, you will get a confirmation mail containing Zoom meeting joining link. Please join the webinar with the link provided. As this link is individualized, it's separate for everyone. And we, of course, are taking your attendance to provide you e-certificate. So attendance is mandatory. Your name and email ID in the Zoom form should be correct, as it will be used in your e-certificates. And if anyone is using any other person's email ID to log in to attend this program, then please inform us. Please inform to our team members so that it will be easy for you to get a correct e-certificate. E-certificates will be provided to all the participants attending the webinar more than 45 minutes, so attendance is mandatory. You will get your e-certificates through email IDs registered with us within 7 days, and thus there is no need to share your email IDs during the webinar sessions. Enjoy the scientific session. Today we have the whole team of Trustras and Messenger Kalpana Shri Babu Singh Jai Singh Ayurvedic Medical College with us, leading HOD, Professor Banani ma'am, and Prabal Dikshit sir. And of course, your moderator for today's scientific session will be Dr. Anjita S. Kabir, Assistant Professor from Rashastra and Messenger Kalpana Department. I will hand over this session to Anjita ma'am so that she can introduce our guest speaker and welcome him to the scientific session. So for now, signing off, Dr. Pritima Isau from Shri Shri University. Yes, Anjita ma'am, you can take over this session now.
Okay, thank you, madam. Good afternoon to everyone present here. Today, we are going to address one of the major health concern affecting people of all age groups, that is low backache, from young professionals who are sitting long hours at desk to laborers engaged in their physical work and elderly people dealing with age related problems. Almost every individual experiences low backache at some point of their life. This makes today's section not only just important but also highly relatable to each one of us. With the insights from clinical practice, we shall share, we shall explore practical wisdom, therapeutical approaches, and holistic strategies that can make a real difference in managing this condition. So, dear audience, fasten your intellectual seatbelt because we are going to dive into an enlightening discussion that bridges classical wisdom with clinical experience. It's my privilege now to invite our distinguished guest speaker, Dr. T.V. Srini sir, Professor and HOD, Department of Rasashastra Evam Vaisheshya Kalpana, Government Ayurveda College, Tripunithara, Kerala, to enlighten us on this very important topic. Before we begin this section, it's my honor to briefly introduce our esteemed guest speaker, Dr. T.V. Srini. Currently, he is working as professor and HOD. Sir was honored with the Karma Ratna Puraskara Award by the Adur Basi Cultural Forum, a statewide organization of cultural and relative activities in 2017, and Distinguished Doctor Award by a noticing medicine manufacturing company, Dr. JRKS Research and Pharmaceutical Limited, Chennai, in 2019. Sir is holding the post of chairman, Ayurveda paramedical examination since 2010 to 2025. The courses included are Ayurvedic pharmacist, Ayurveda nursing, and Ayurveda therapist. Sir is working as Board of Studies member of Ayurveda Preclinical UG Kerala University of Health Science. Sir is working as honorary editorial member of Indexed Journal of Research in Indian Medicine. Also working as in the editorial member of Kerala Journal of Ayurveda, International Journal of Ayurveda, specialties in published by Kerala Government Ayurveda College Teachers Association. Sir has published many research articles in the famous journals like International Journal of Ayurveda and Pharma Research, Journal of Ayurveda and Integrated Medical Science, International Journal of Ayush, International Journal of Health Science and Research, and so on. He has delivered several impactful presentations at national and international platforms where his insights were highly appreciated by peers and professionals alike. He has been featured in multiple media platforms, including Doordarshan Thiruvananthapuram and Jai Hind TV, Agashwani, and Anandapuri FM programs, reaching audiences across Kerala. And now we are eagerly waiting to listen to you, sir, with the same excitement and atmosphere as if I am once again sitting in your class. It is truly my privilege to invite my guru, Dr. TV Srini, to deliver today's speak. Sir, the section is over to you, sir.
No,
Yes, sir.
I am really happy because today I am having class to German doctors, German and modern doctors. There are some 1 p.m. to 3 p.m. and class about the synergetic action of Ayurvedic formulations. When class is there, then after that I practice. Practice is going on there. Now just in between that practice I am taking this class. So what is why R&B in our science, why we are getting practice? That I will tell you what is the importance of practice there. So I am going to start my presentation about this low back pain. Anyway, this first my service to road Dhanvantari, because who is the person who is from, I have started my DAMS from Coimbatore Ayurveda College in Guriguda modern system of medical that we are following there. And there, in every day morning, we are do the Dhanvantari puja. We are do there. It's compulsory there. Then after that, we have to do the yoga, etc. It's a traditionally following college, Ayurveda college earlier. Now, after the entrance examination, the people are appointment through the entrance examination. So the rules is some different. So here I am going to start low back pain. So what is the importance of low back pain? Because now I will show one X-ray report just before going to the presentation. I will just 1 minute. We can see this MRI report. How much the disc is protrude out, and it is called as disc migration. It is not disc prolapse, it is a disc migration. That is downward migration, you can see. Only 3.5 mm is there. 3.5 mm is there. That is the disc prolapse. So the surgery is inevitable. We call it as cauda equina syndrome because here the caudal roots are compressed. I have given medicine for 3 months. Only OP treatment. There is no IP management. I didn't do any Panchakarma treatment. Any Panchakarma treatment. Like I am totally against this. Why I am totally against this, I will tell later. So you can see that after I have taken the MRI and you see how much it is reduced. Now it turns to 8 mm. The result is with me. You can see that. A lot of MRI are before and after MRI. I am so collecting the before and after MRI. as a documentary evidence and published some articles also. You can see that the before MRI and after MRI, what is the difference is there. So here the caudal migration you can see, and here there is no migration. You can see just see caudal no migration is there. So this is the thing that we can do by our Ayurvedic treatment. That means with the OP management only. I am telling not about any IP management. Okay. So that is the importance of Vaishya Kalpana. That is the importance of medicine. So here, just I am going. It's a fresh up only. Just I am going through the anatomy of spine. Just we will go through the treatment protocols later. So what is the anatomy of spine? First, there contain 33 bones. That's 7 cervical, 12 thoracic, and 5 lumbar. Here, the thing is that whatever happening to the lumbar region, the same will be there for the cervical region also, because the body linearity is like that. So whenever we are doing MRI scan, when you are doing suggesting MRI scan, because soft tissue for soft tissue disease, the first and the foremost investigation is the MRI, not CT scan. CT scan is for the bone. So whenever you are writing for MRI, just try for MRI screening. MRI whole spine screening is needed, not MRI spine or MRI lumbar region or MRI dorsal region or MRI cervical. Do the MRI whole spine screening, you are right. Okay. Then here cervical, 12 thoracic and 5 lumbar. In the 5 lumbar region, the most affected area is L4, L5 and L5S1. And the cervical region, most affected area is C4, C5, C5, C6 and C6, C7. These are the most affected area. So they are made up of 33 all things we know. Then low back, also known as the lumbago. Typical common area of back pain is the low back pain. Then lumbar region, somebody is to the buttocks and leg. That is it is called as sciatic pain because of the in course of sciatic nerve throughout the course of sciatic nerve that pain will be there. Okay, there is a lumbar pain. I think these are things that we know. Then cause of the low back pain, that is congenital. Maybe congenital issues will be there, like what are the congenital issues that we will discuss later. Then traumatic condition, functional defect may be there, inflammatory conditions, sacroiliitis, pain, etc. Discitis will be there. Then degenerative, the neoplastic is cancerous. The next is abdominal disorders, pelvic disorders. For abdominal disorders, any kind of renal calculi, the pain which is growing to the loin, and our same pain will be there in an L1, L2 compression. And pelvic disorders also, maybe some kind of this pelvic inflammatory disease pain will be there. Then vascular disorders. Then the kind of congenital, mainly the spina bifida. Spina bifida, I think you must know. I will show the picture. That spondylolisthesis, then hemivertebra, that is partially developed vertebra, then split vertebra, and the articular process of normality. I think we must know these things. This is spina bifida, first picture, then spondylolisthesis, then hemivertebra, then you can see the this compression fracture. You can see this is the compression fracture, and this one is the hemivertebra and split vertebra. You can see split vertebra here. Okay, I think you are able to follow me. Okay. So next is the compression fracture. This will be there. A lot of patients are coming because elderly people are coming, and the pain and numbness will be to the both the lower limb and maybe the dorsal spine. That means D12 and L1 compression fracture is the reason. So normally, so it may be there for elderly people, and they don't know because of the osteoporosis. There is compression fracture. Then functional defect, only anterior posterior imbalance, then lateral imbalance, then pregnancy. Pregnancy is one of the main things that is for ladies. Then pot belly, fixed flexion, deformity of hip joint and scoliosis, leg length discrepancy. Leg length discrepancy will be there in osteoarthritis. In ONE, the leg length will be affected due to the pain and due to the meniscal tear or meniscal degeneration. So the pain will be there in the lumbar region. So whenever we are whenever there is an ONE in the severe stages, we can do surgery to replace this knee joint, but then also there will be pain. Okay. So inflammatory changes, pyogenic osteomyelitis, then tuberculosis, then rheumatoid arthritis, brucellosis, ankylosing spondylitis. We call it as Sandigata Vada, then myositis and fibrositis. The next is neoplastic, primary tumors. Multiple myeloma is one of the main thing. And here we are do the this immunofixation test. First is that is immunofluorescence. M-band should be run. Then we are do the immunofixation to rule out free lambda, free kappa. That is the one test. And ESR and CRP will be more there. So serum immune electrophoresis and serum electrophoresis we have to do. Then metastatic tumors from the breast, bronchus, kidney, etc. will turn to that is this lumbar means vertebral tumor. Then other than by abdominal disorder, pancreatitis, cholecystitis. So do ultrasound abdomen if nothing is there in the MRI spine. Then biliary calculus and pelvic ulcer. Then is hereditary urinary causes, that is renal infection, renal ureteric RCC, renal carcinoma, renal cell carcinoma, then vascular disorders. Next is lumbosacral strain, fibrositis, Meningeus low back pain, sacroiliac strain, sacroiliac arthritis, and TB of sacroiliac joint. Okay. Examination. Then history you have to take. So ESR, if TB history is there, you have to roll out any kind of cancer, that is papillary carcinoma, then breast cancer, etc. You have to roll out. Then local examination, then general examination and special investigation. So history, age, sex, trauma, pain, site, onset, character, radiation, aggravation, relieving factor. Then local examination inspection, attitude and deformity, gait, swelling, palpation, tenderness, swelling, wasting or rigidity is there. You have to go for that. In MND also we can see that. Then muscular dystrophy, movements, lumbar spine flexion, extension and lateral flexion, measurement, then SLR and FNST you have to do. Okay. Then neurological signs, cold abscess, primary carcinoma. Then X-ray, scan and MRI. So MRI is the gold standard to rule out any issue. Then intervertebral disc. See, this is the disc. These are things we know. So intervertebral disc collapse, that is nucleus degeneration of first occurrence. That is before that there will be dehydration. That is dehydration leads to degeneration. Then weakening and disintegration of posterior part of the annulus. That leads to nucleus displacement, disc protrusion, then extrusion and sequestrated disc. Then fibrosis. So bulging, protrusion, extrusion, and sequestration. This is the stages, 4 stages. Okay. So these are the advices we are giving. That is posture. This is the corrective posture, first one. And the fourth one is the corrective posture and weight bearing. I will show some other thing also later. Okay. So this is a good posture we have to maintain. This is the second one is the good posture while driving. And this is the second one. And weightlifting. Then computer, when you don't, so much bending is not suggested there. Then treatment in modern as pharmacotherapy, then medicine, then physiotherapy and surgery. This modern medicine we are telling. So in pharmacotherapy, they will give muscle relaxant, then steroid injection, that's intrathecal injection and painkillers are giving, NSAIDs. Then corticosteroids means they are using prednisone or dexamethasone. Then non-steroidal, mostly they are using this Ultracet like painkiller. Then analgesics, anticonvulsant, antidepressant, and topical analgesics. Then physiotherapy, stretching of strengthening of back extensions, mainly thermotherapy. Okay, that is the therapy they are following. Then surgery, decompression of spinal nerves, fusion and stabilization, correction of deformity. Okay. Then Ayurveda perspectives. What is meant by Ayurveda? What is our general concept? To assist the body in self-healing. To assist the body in self-healing, because body is having a self-healing power. So we are assisting the body for self-healing. Okay. That is just I will give you just to go through it. What is wellness? Optimum external and internal stimulation. Illness is inconsistent external and internal stimulation. And therapy means that is regulated external and internal stimulation. That means we are treating the patient and the condition, patient and the disease, Dusham, Desham, Belam, Kalam, Analam, Prakriti, Vayaga, Sattam, Sadhmi, Avastha, Pradakvida. So we are studying these 5-10 things. So we are regulating the lifestyle modification. We are advising the patient. The spiritual modification, we are asking them to do some prayer, etc. Then internally we are giving medicine. So I think you can follow this. So next slide, you'll see what is therapy in Ayurveda. So regulated. This regulation is according to the condition of the patient and the disease, challenges the body in a combative and disease-specific manner. Body respond to this challenge. A positive reflex help the body to correct it. That is, we are doing the physiological correction of Vata, Pitta, and Kapha. So that will turn to the internal correction. So next is the modality of treatment. Mainly there are two modalities, Andha Parimarjana and Bahi Parimarjana. Andha Parimarjana, we are giving internal medicine and they are operated from inside. This is good. And external Parimarjana, only cutaneous sensation. So this spiritual kiri, etc. The things which are doing in Kerala. In my view, only 95% of the diseases need only OP management. There is no IP management necessary. And only 5% is needed IP management. Only 5% is needed IP management. So what is Kadigraha? Vayu Katyacharada Sriddha Samova Janiyadrujam Kadigraha Vigneya. So here you just see Gradrasi and Kadigraha, the main diseases that we can correlate to the sciatic pain and this low back pain when we are going through the symptoms. Here also you see Sipporva, Kadi, Prato, Uru, Jagga, Padam, Kramat. That is the course of the sciatic nerve, Gradrasi. So these are the two conditions that we can correlate with IVDP in modern medicine. Okay. So that is, then is Pakvashagata. Here also some symptoms will be there of the IVDP symptoms will be there. So one is Kadigraga, next one is Gridrasi, and the third one is this Pakvashagata. Okay. Then the important medicinal formulations. Here mainly the symptoms, the important medicinal formulation I am using is the Churna Kalpana, Vaishwanda Churna and Ingvajati Churna. These are the Churna Kalpanas that I am using in the beginning. And there the Kwada Kalpana, mainly the using Kwada is Rasasaptam Kwada, very effective in all the aspects of IVD. And you can add this Limba, Sindhuvar Eranda or Nargundi Eranda, any this Eranda Kalpana or Limbamar the Eranda, along with this Rasasaptam Kwada, and it's very effective. Then next is the Gandharvasadi Kwada, that also is very effective. Only one thing is that Gandharvasadi Kasha is having more Doshishavana Sabhava than Vyadhishavana Sabhava. Because whenever you are using Gandharvasadi Kasha, you just see the Pavanasya Chandir, Vanir Belaya. Pavanasya here means Vada, Vanni means Pitta, and Ruji means Kapha. Pavanasya Chandir, Vanir Belaya, Rujaye, Malashodhanaya. Pavanasya Chandir means Vada, Vanir Belaya Pitta, and Ruji means Kapha. And there the three malas are mentioned, Shtade Malashodhanaya. That is here the three malas will be corrected by giving Gandharvasadi Kachaya. So it is having more Vyadhishavana, more Doshishavana Sabhava. So can given n number of conditions in our body. Okay. Then I am using the asana, this Bela Guluchadi Kachaya. It is three medicine, Bela, Guduji, and Devadara. It's very effective in IUDP. Then Sagajaradi Kwada and Rasayandadi to some extent I am using. Desmodan Kwada is very effective in spondylolisthesis. So next is internal Snega. So firstly, we have to give this Eranda Kalpanas. Maybe I am giving it for 20 to 30 days. Nimbamrda Eranda, Kapavada Samana. Sugamar Eranda is having more, that is lower area action. Sindhuvaranda is very Kapavada Samana and is having more action on the IVDP area that we discussed, perhaps, and Gandharva Eranda. These Eranda Kalpanas are, so mainly when we are using Nimbamrda Eranda Kalpana, different Eranda Kalpanas, you can use Nimbamrda Eranda in skin diseases, Sugamar Eranda for this genital urinary condition, and Sindhuvar Eranda for IVDP like conditions, and Gandharva Eranda also as general Shodhana purpose you can use. So these Eranda Kalpanas are very much role in IVDP. And Sagajara Madhyama Bhaga and Dhanindra Madhyama Bhaga, that is Veduka Bhaga, we call it our Mati Bhaga, internally from 10 to 15 ml daily. Daily I am giving, and for about 30 days, monitoring the cholesterol level. Then Sagajaradi and Dhanindra Chedavela Avarti also I am using. Then Rasajamoradi Kradam. Later I am giving. Then this Gugulita Kradam also. The last choice is to Gugulita Kradam. I will not use the Gugulita Kradam continuously because when the Gugulita Kradam, Purana Gugulu is having this Prayada Karata Sabhava. But now the drug are prepared out of fresh krida, fresh gugulu, that is not having it is clear the karatha svabhava. So don't use krida, gugulu krida in the beginning because it will vitiate the kapha. And Lekhikalpana I am using Dashimula Haridaki and Sukumar Rasayana. And Google preparations, Trayodacha Gulu and Yogara Gulu I am using Kashirgo to some extent, Simla, the Gulu and Ava Gulu also. Legal Pena already Sukumara Haridaki, Sukumara, Dashimula Haridaki and Sukumar Rasayana. So Tanya Amala, along with the Jadamaya, so I will show one video, which is not my presentation, part of my presentation, but I will show some videos. It's a part of another person's presentation, but it's very good. I will show that. And Tanya Amala, along with Nagarad Churnas, also Banaga said I am using. Then Kiri without disturbing that affected area, and externally Thyla is not advisable. Externally, Thyla is not advisable. Again saying externally Thyla is not advisable. So internally thyroid you have to give. Externally it's only cutaneous sensation it will work. So Kadivasi to some extent I am then different Vasti yogas as per condition if it is needed. Then not regards the coastal treatment like preaching the starting of so that in Kerala we are doing. Then Marmaguliga can also be used if Leva Danyamla is contraindicated of giving allergy because it is aesthetic permanent. So then tab capsules and liniments I am using. So much liniments I am using for external application. Otherwise, they will go and apply this Morivana, etc. Will cause some having some side effect. So some patents of this AV and Arividan Nilayam and this Nagarjuna, some gel capsules are there, like the Lumbarton of AVN, Lumbajit of AVP, then Sarvijit of AVP, Sarvilon capsules of AVN, and this Lumba this Lumbaton and Cyatrilon capsule of Nagarjuna, etc. I am using, Sarvilon, etc. I am using. These gel capsules are very effective. And some ointments also I am using. That is experience based only. I am telling, I am not promoting any private companies. Then after that, you have to do the Resa, Madhura, Amla, Lavana Resa. You can use Pathya, that which you are intended to do. Then Nava, Godhuma can be there, Navashali, etc. Then Simbi Danya, Shaga Varga, Padola, Siguru, Vartaga, etc. These are things which is from the books I have taken. Anyway, Danyamala can be given to some extent internally also. Okay. Then the Pathya, Vihara, present activities, physiotherapy, exercise, and yogasana, etc. according to the condition. Then Abatyas means Kadu and Kashaya. Abatya is to be given, and Chugatanya should be given. Kadu and Kashaya, because it will increase the Vada there, Sindhi Varga. These are things Rajamach, etc. that avoid. Then Nidana Parivarjana, but things to yourself. Then this excessive traveling and all these things you have to avoid. Then lifestyle modification, smoking cessation, while lifting the objective, squat and lift the objective, while sitting and driving, keeping spine straight and using backrest. Sleep sideways with the knee and hip the bend, while sleeping on back, put pillow behind your knee. That I will show. Then you have to do the exercises. And this Pavanamuktasana, Ardha Siddhi Sarvangasana, etc. is there. So these things you are doing. So these are things I have to tell, and some other things just I will go through it. I will show one video. Firstly, I'm saying it is not a part of my presentation. It is of one another presentation. They are very clearly on low back pain. Just I will show some slides from that. The most sign we are seeing in this area is the pain in this area. If you just see the first pain, the patient will say that the pain in this area. So it is definitely it is due to IUDP. And the next is that you can see the where that pain comes. That is L4 L5 pain. You can see that L4 L5 pain. There usually I am showing this video to my patients. Otherwise, they will not do the investigation because they will say that pain is for the leg. Then why I am doing the MRI? So I will show this video to the patients. And for prevention, the things I am generally saying that, and one another presentation also I will show, sit straight. And when you are standing, put leg like this. Then you have to put pillow like this. You see pillow like this. And also you have to do the lepa like this only. Let's show the lepa. This lepa like this. And also whenever you are applying any oil, do like this. And when you are doing kiri, like process, just to put there. If you are listed, don't do any kind of thing, any kind of procedure there. Okay. Then the yogasana, basic yogasana that you can tell is that this one. Not Panamuktasana, this asana you can prescribe. There is Ardha Halasana. There is here you have to tell that don't do like this. Whenever pain is there, just stop there. Like that you do. And next is the you can do this Pavanamuktasana. And there also ask them to don't bend their neck if neck issue is there. These are things. And on the other slide, just I am showing to the patient. That also I will show you. This presentation I have done in Kazakhstan for one presentation. Yes, I will show the thing that what we are doing. So this is the way of lifting objects. You see, and this is the way of standing. Not this way. You just see the right and left picture. These are the things that I am showing to the patient, every patient, because lifestyle modification is very compulsory here. And this one you should see. And here also you can see that. And here how to sit in a chair. And here also how to drive a vehicle. And the way of the lying. And the pillow size. And the belt that's usually I prescribe double lock lumbar sacral belt. And you have to wear mostly upwards. And also ask the patient to buy a chair like this. If the ready patients are having so much work in kitchen, ask them to 15 to 20 minutes sit in a this kind of chair to work for continuing their work. And my experience I will share next. So this is the case of lumbar sacral pain, lumbar pain, and they approached me after several consults with the modern doctor and Ayurveda doctors. You see that there is a very big tumor there. Further watch a contrast MRI. This is a size lesion, L5S1 lesion, because she is having severe numbness in her lower limb, and I referred the case to for further MRI, severely complex caudal aneurysm, and referred to this one of the famous centers, Rajitra. Dr. Easter is very close to me, and they are done surgery, removed that area. It is a very famous. It is a tumor there. So another case I will show you. This is the case. This is the case you just see. This patient only having there is lower limb pain below the knee joint, and the patient is only since 14 years old. So this is 34. So only the modern doctors they call it as a growing pain, and they have given vitamin D3. But see the X-ray changes, MRI changes, C3, C4, C4, C5, C5, C6, C7. Then can see spondylotic changes in listus L5 over S1 and grade 1 listus L5 over S1. Disc bulge is there. So this is the result there. You can see that. So I have done 2 MRI, whether it is increasing. So compared to previous scan, the MRI it is increased. So don't reluctant to do the find this kind of means investigation is needed. Is needed now. Okay. Then I will show one another case. There is a case of this chondroma of sacrum, and it is also removed. We say patient just see the disc damage. Then C for C5, 7.7 mm, C5, C6, 5.6 mm, 7.8 mm, 8.8 mm, 8.1 mm, 3.4 mm, 3.5 mm, etc. So this much cases, another case I will say. They are also just in the age 16 years. And the result 8.3, 5.7. It is called a compression, the caudal compression. This patient is also going with the lower limb pain, and I treated with the OP management. And after that, the disc is so much L4, 5.5, and later turned to normal. This is the medicine I given. Dagulichedi Kasha tablet, Tasnanthan Kasha tablet, etc. with the Sindhuvar. Later turned to this Dhanandra Megadu very Vasti Paga. Then later the Simunari, etc. The medicines I given. So these are my experience that I am sharing. So there are questions we will answer later. Definitely, I will answer. Some other thing just I want to see. I want to say this is a very good case. Just telling you, so I say that I got to know that which I do. We just see this case. Just to read this. Large heterogeneous lesion, 9.2 into 6.2 somewhere on the right ovary. Along the heterogeneous lesion, 5.5 to 3.7 centimeter. So it is not IVDP. This patient came with IVDP. So I have done with all this investigation. They see one, cyst, next cyst, then the third one, then the fourth one, and the fifth. Age you can see this 35-year-old. So very large structure. When I got medicine, Traindia the Kasaya, along with the Kanjana Gugulu, then endoton capsule of Charaka pharmaceutical Churnam. Then later I given this Traindia Varanadi endoton. And after that I given, I think one percent I lost there. This is with this Kalyanacharia along with Sukumar. So after that, just see the size of the system. 10 to 10.10 mm, not centimeter, 10.10 mm and 1.6 to 1.2 centimeter. And earlier, just to see that, what is the difference? How many cysts are there? Just think. So for IVDP, this patient came to me and I given medicine. Okay. So now you can ask me questions. Any question means any, because I am a practicing doctor. So you can ask me questions about IVDP and etc. thing. I will explain. Okay.
Thank you, sir. Thank you. It was really an enlightening section. So you have covered every important aspect, right from the anatomy of the spine, the causes of the low back pain, then the modern management, including the importance of physiotherapy, then straight to the Ayurvedic management, how well we can manage low back pain with internal medications, and the pathyas, apatyas, yoga asanas, and all. So it was really an enlightening section, sir. Now, this section is open for the questions. So, uh, all the participants are requested to type your question in the chat box. As many of our students are here, I'm sure that they are having a variety of questions in their mind. So, it can be answered by our speaker. So, straight to the question, sir. So Dr. Shreya has asked, sir, what would be our lying position while sleeping?
That I will show. I will show. I will show.
Okay. Sir.
This is the common line position. And when you, if you are having pain, you can use this method also for the relaxing posture. This one. These two are the lying postures. Okay. Then next question.
Okay. Sir, can low back pain causes permanent disability? If it does, how will it be managed?
Yeah, permanent disability means what should be? We have to find out the reason. What is the reason behind this disability? If it is a sciatic pain, etc., we can manage. And it leads to any Kodaikanal syndrome leads to this bladder incontinence or this any issue related to that. Then if surgery is needed, you can do surgery. Then if it is needed, then also after that surgery, you have to just support a neurosurgeon, not to orthopedic surgeon. Neurosurgeon is compulsory there. And here my friends are neurosurgeons. So I am just refer the patient to the neurosurgeon and they will do the neurosurgery and again referred back to me and I will follow because whenever we are removing the discectomy, disc is removed there, the other discs are disturbed there. So whenever we are doing surgery, then also we have to do the continue our treatment protocols. If you are taking painkiller, the patient will not knowing about the pain and they will do follow up with all the things that they are following and the other disc also will be damaged.
Okay, sir. Now, Dr. Devanshu has asked, quoting one experience of her uncle that is having nerve compression at multiple levels from L2 to sacrum, and he was advised for surgery from the AIMS Delhi. And now there is a history of balance issues are there and falling down frequently. So, in this case, what can be done?
It is because of myelopathy. Maybe we'll go through that. Maybe cervical area compression will be more there. That is the reason for falling. And also there will be myelopathy in the lumbar sacral region. Maybe in the L4, L5 region, myelopathy will be there. And there also we can treat and we can manage. Just you search for my name there in one article I have published about myelopathy there. It is available in net also and in ResearchGate also. And also they need a continuous treatment. Because then also if the bladder incontinence is there, we can refer for surgery. Otherwise, if people are ready for continuous medicine, with all this, you have to wear the belt. If it is a double lock LS belt or this dorsal lumbar corset and the cervical collar, etc. And if we are ready for that, then we can continue the treatment. Otherwise, it is very difficult because if the cauda syndrome may be there, that is because of that this patient maybe the falling is there. Only after seeing that MRI report and the not MRI report itself, we have to see the MRI film also. Then only we can say that whether it is needed or not.
Okay, sir. Then
This abdominal TB and low back pain will be there. You can do the first rule out the MRI spine to roll out any discitis which is there. To roll out any discitis there. Otherwise, you can do this do the treatment for this abdominal TB, and it will not cause this. Only pelvic pain may be there, and the other will not be there.
okay, sir. Another question has asked: is there any relation between abdominal TB and low back pain, like
No,
lumbar
I
compression?
will answer because abdominal TB there is no connection. Maybe pelvic pain will be there, and if the TB is there for the this disc region, then only there will be pain. Otherwise, there will not be any pain, and pelvic pain may be there.
Sir, another question: low back pain treatment due to hemangioma in lumbar spine.
Hemangioma can be treated. Don't do any kind of surgery because in modern medicine also they will do. In modern medicine, we can give this Varanadi Kashaya, Varanadi Quadha. This to some extent, Google with the maybe the Sumayardi and Sukumar Rasana will work there. Can be definitely managed with our medicine. No issue.
Okay. Sir, another question: what can be done in case of thinning of lumbar vertebra and it is shifted to the coccyx due to falling in old age?
In falling in old age, there is no surgery. That makes the fixation is needed there. And, I think this is the modern people, they also don't do that fixation. I will show that fixation how they are doing. Just I will show that. But that also is not necessary. If the people is ready for treatment, you can suggest a dose number corset and then internal medicine like the Kardakarpana and Tailakarpana, etc. internally. Yeah, mostly effective medicine is the Rasa Stimulati Karda that I am using. Rasanadi Karda, that is Rasa Stimulati Karda, which is mentioned there, I think, in Kasa, I think. It's very effective. Can be given.
Okay. Then Sumit has asked: is there any treatment for muscular dystrophy in Ayurveda?
Muscular dystrophy, I am having patient. And I am using this Shilajit. Shilajit is done Bhavana and Vidarya the Kwata and so getting some result. I'm not saying that fully, but getting some result. Internal medicine, not externally. Don't do any kind of Shastika Pandasveda and this any kind of oil application. You can use Shilajit. Shilajit is very effective, and one thing I am using is Sivaguliga or this Kaudajatapra. It's very effective. First do the Lengana, then you have to do the Bellia and not Brahmana, Bellia medicine. And you will give very good result. But it is not a promising result, but give a very good result. In modern medicine also, they are not in contemporary medicine. I am calling it as contemporary medicine. They are not doing any kind of medicine. They are not giving.
Okay, sir. Another question from Marisha: can stress cause low back pain?
Yes, one of the main thing. One of the main thing and the one of that should be addressed nowadays. The people are having this fibromyalgia. The people will say that they are having low back pain, but there is no low back pain. It's purely out of fibromyalgia due to the stress it is having. So it is a very difficult one treat also. I am having a lot of cases in my OP in college and here also, and I am having a group there, and I am sharing my experience with I think Dr. Anjita also knows that because in the previous week also I have shared one picture of one famous musician's wife given to me because she's having severe low back pain, and I have done the MRI spine. There is nothing is there only because of that somatoform disorder and fibromyalgia. She's having that pain. That fibromyalgia site also I will show. Just 1 minute I will show the fibromyalgia site, same site. 1 minute I will show that. During my consultation, I will show all the slides of my patient. For about 20 minutes for consultation, I will show after diagnosis. So this is the site of pain in the fibromyalgia. You can see that. The pain, site of pain, fibromyalgia. The places you can see. So there will be pain. That is, pelvic pain will be there, and the sciatic pain will be there. And you have to rule out by do the MRI screening, then teach the patient about this, because for fibromyalgia the symptoms are real and disabling. For fibromyalgia the symptoms are real and disabling. So then we have to educate them. Okay.
Okay, sir. Next, Dr. Abhiranjan has asked, due to lower thoracic and lumbar vertebral trauma, the patient went to surgery and developed diplegia and incontinence, bowel and bladder, and now came for
Paraplegia,
Ayurvedic management.
paraplegia. This is out of
Huh.
surgery because in the lumbar region, dorsal-lumbar region, maybe a D12, L1, L2, etc. areas. If D12 and D11, D12 area, if there is a fracture, there will be paraplegia. Continuous medicine may give a result because long duration and also physiotherapy is compulsory. Don't do any kind of this etc. because it will not work there. So internally, Sneha and mostly I'm using the Savajara, Vastibhaga and the Danindra Vastibhaga internally with external this physiotherapy, and it's very effective also.
Okay, sir. Another question has asked, can we know Ayurvedic management of meralgia paresthetica?
It means Maragia, Parathetica means, yes, I want to go through that condition. The condition, yes, I want to go through that. Anyway,
These sting like burning pain in the anterior lateral of thighs.
that wasting and this is, only one thing is that whenever we are doing Ayurvedic management, generally I will tell you that generally this Gandharva because I already told you now. It's having action, Pavana says Shantir, Vandir, Balai, Ruchi, Manaswas, and can be given in varicose vein, not a varicose vein, I am saying varicose vein. And I am giving this Gandharva Kashaya for infertility and Saptasaran Kashaya for IUDP and this gynecological compound. So we are not bothered about the names of the disease. We have to go through we have to do the diagnosis mainly by the modern investigative method. You can do the MRI scan or CT scan, etc. Thing. I am doing all this investigation, modern investigation. But after the investigation, I will coordinate the symptoms into Vata, Pitta, and Kapha. And then I am giving medicine. There you can see in Varanati Kashaya can be given in any kind of this Kaphavada Pradhana tumor, can give in this fibroid uterus. You can give the medicines in gallbladder stone. You can give the medicine in thyroid adenoma cancers. And Trayandhyati Kashaya is covered with the you can give in pituitary adenoma. So according to the condition is needed. If such a condition, you can give Maharashtra the Kwada with the Chireguluji. That is Chireguluji is the instead of the Bella, we are doing Guluji Avarti. So it is very effective for that condition. And also you can use this Kanmad Asilajit Skaudet or Shivaguluya can be given in such a condition and will give the good result also.
Okay, sir. Now another question. What will be the treatment for grade 4 anterior listhesis?
Grade for antilisthus, I will show one thing. Just whenever just one case I will show. And the MRI also I will show. And what are the medicines that they will do? That I just I will show. This is the grade 4 lithosis. This is my patient. You can see that grade 4 lithosis. I'll show the MR report also. And I find out the case. And diagnose the case. You can see Karthik, 21-year-old. My name there. You can see that grade 4 lithosis. L5 over everyone. And I have suggested for surgery and referred to Sri Chitra, and they didn't do anything. They didn't do any medicine. They will prepare and ask the patient to consult me again, and I am giving medicine. This is another Vastipaga internally, and this is another case I will show. This also I are referred. This case is a serious one. I referred this case to Dr. Mr. there, Dr. HOD and Sri Chitra Trivandrum, and he he did not do the surgery. You can see that. However, due to technical reason, the patient needs surgery, but due to technical reason, and patient is being referred to Arthritis Medical Center. They refer the case to Prabodhini Medical College. Rita is a neurology center. Can see, and I have referred the case to my friend there. He had done the fixation, internal fixation. It's a very serious case. I will show that internal fixation because he is my classmate, and he sent me the video. What they have done. This is the way they are fixed. Just see the fixation in lithosis fixation. And also the treatment now, the after surgery treatment I am doing. To see that. And another side also, this side that person, that doctor forward me, my friend, Dr. Biji Bagle, a famous neurosurgeon, to see the fixation. The grade 3, grade 2, I think that. But this surgery I suggested only because that this time show the result also. It contains a very large ductal ectasia, dural ectasia. There is causing scalloping of the adjacent vertebra. It's only thing that surgery, that MRI picture is not with me. But it's a very serious case. So suggested for that one. I already told you for me. So you can suggest all the activities to be very slowly she has to do. The three and also precautions, the lifestyle management, etc. She has to follow.
Okay, sir. Another question from Malo Grenson. After pregnancy, often ladies complains of low back pain, which make them difficult to stand from sitting position. So what can be done
Then
in
I
this
have to
case, sir?
first you do the investigation. If issues are there, then you can give internal medicine, the Shimulan Quada, etc. Because then they are feeding in the feeding. So the Shimulan Quada is very effective. Don't give any Grafanavi Quada, etc. And also, if it is the problem is there, we have to do the suggestive this lumbosacral belt also. And lifestyle model, the way of feeding, etc. You have to teach them. And very definitely the pain will be subsided. 100%. The pain will be subsided with our medicine.
Okay, sir. Then our second prop student, Udit, has asked. He has quoted his own condition, telling he have low back pain from suffering from 9 to 10 months, and it increases in the lying position. So
Do the investigation whether we have done any MRI X-ray of the findings. One we are done. If otherwise we have to do that. Then if any disc issue is there, then we have to manage it. Otherwise, if only paraspinal muscle spasm, then maybe you can do any kind of LAPA. Don't do any kind of don't apply any kind of oil. You can do any kind of LAPA there. Then you can do manage.
okay, sir. Now Rajat has asked what all will be the complications if Kadishula is neglected.
Yes, Kadishula, if the disc prolapse is there, if it is neglected and don't give any medicine, not any medicine for pain. As per the condition, we have to give medicine. If it is needed, that leads to the cauda compression or leads to the paraplegia. And if it is in cervical region, it's quadriplegia.
Then, okay, sir. Then another student has asked, how do we diagnose whether the pain is from lumbar spine or is it muscle or kidney, related to kidney? How to differentiate?
For kidney, that pain will be from the groin to the loin. If stones are there, groin to the loin pain will be there. That only the pain. Another pain will be that is which from which nerve. But I already told you that L1, L2. This I will again I will show that this bundle. This is T12 L1 pain. See the site. This is L1 L2 pain. See the site. See the site which is sudden in nature. L2 L3 pain. L3 L4 pain. L4 L5 pain and L5 S1 pain. So the generally pain starts from here, this area. So the T12 L1, L2 L1 L2, L2 L3, L3 L4, L4 L5 and L5 S1. So this is the type and character of pain. It presents sharp, stabbing and radiating pain. Pain can be shooting in character and increase with the physical activity, especially lifting, bending, sitting and exercise that increase the abdominal pressure. Ache, shooting pain, pins and needles pain, sensation in spinal stenosis, done like throbbing pain and slowly progressing in malignancy. These are symptoms mainly we are following. So aggravating and relieving factor we have to find out. There is worse or better when assuming in certain position. Cannot be get comfortable and who does not want to remain still. Worse when staying in standing or prolonged periods after a prolonged riding in a car, or worse when coughing and sneezing, worse when walking. Worse with any back or torso movements.
Okay, sir. Now another question. The management of avascular necrosis of hip joint.
Vascular necrosis is also a very good condition I am treating. And modern medicine hip replacement is the only one thing. And the replaced hip is only having 12 to maybe 12 years, maybe up to 14 years. In the active age only, they up to 12 years it will work. And second is that they are using this another fixate, internal fixate, just I forgot the name. Anyway, these two methods are using. But in our medicine, we can give, firstly, we have to ask them to, that if any length differences for the legs is there, ask them to wear a chapel to maintain the length correction. Then you have to give first you have to give the Lengana Chikilsa, like this Rasana, Pada, Maharashtra, etc. can be given. Later, Kritakarpana, because in Astidadu, Krita is needed. So this Rasana, Krita, Google is the Genda, etc. can be given internally, and lifestyle mode is compulsory there. A vascular necrosis grade 1 and grade 2 can be managed. Grade 4 need the knee replacement is needed there. And to some extent, if it is after 50 or 55, it is okay. And before that, is maybe it will cost again. They do the resurgery after 14 or 12 or 14 years.
Okay, sir. Another question. What will be the treatment for cervical spondylosis in Ayurveda?
In cervical spondylosis, the same way of following we have to follow. And internal medicine is needed there. This Kvatakalpana that mainly I mentioned in the that the slides it is there we can use. And only one thing is that myelopathy is there. Don't apply any kind of oil and any kind of heat there. And also leba also not possible. You can use this marma, KM leba is there. Marma leba can be there. And this right you have to use the continuous towel is there. Lifestyle modification is advisable. And I will show one slide again for that. This for me. Can apply oil here, not apply oil. Labas here and pain is the mode of pain. And if you see the MRI findings, so you can see this is the MRI findings. You can see this is myelopathy, white color you can see. And this is next slide I will show. This need surgery needed, maybe. Surgery is needed, not surgery. You know, in my case, I will not do surgery. I can treat, I can manage. This is the case. You can see spondylosis there. Then for IVDP also, and also this is one MRI findings. You can see the first MRI is the RMR is on mild bulge. Here the mild bulge with the this caudal migration. Second one is mild bulge with the caudal migration. And here you can see these are things you have to follow while for cervical spondylosis. And this is a disc bulge in there is an animated picture. And this is the caudal compression. So pain will be there. And this is the caudal compression. You can see that disc migration. And this is one picture. So the pain, you can see L1 pain where, L2 pain where, L3 pain, L4 pain, L5 pain. And like that cervical T1 where L1, L2, L3 pain. And upwards you can see the C2, C3, C4 pain. The pain you can see. Okay. Then This is the lift fish. Spinal lift fish. You can see my disc projected there. And this is quad kind of compression and surgery. That is internal fixation. Okay. This is the way. Here, first one is a mild bulge, second is moderate bulge, and third one is a caudal migraine. Okay.
Sir?
Yes.
Okay, sir. Now we will take one last question, sir. Our chat box is actually filled with a lot of questions, sir. And now it's already 8:12. Now we will take one last question, sir.
Yeah.
Our second prof student, Avyukt, has asked, out of all this management for low back pain, on your opinion, what will be the best Ayurvedic treatment? Because we have Panchakarmas, Yogasanas, physiotherapy, all of this. So, out of all this, what will be the best?
Multiple way of treatment is needed there. Internal medicine is compulsory there, and external therapy, this Panchakarma therapy, I will not advise. I will not advise any kind of Panchakarma therapy. Only there is Snehana, with Snehana means Dhanandira, Vastipaga, or the Kritakalpana, different kind of Thalakalpa internally. And externally, nothing is needed, only Lepa, and then do the physiotherapy, and to some extent, Yogasanas, according to our demand. And physiotherapy and Yogasana is very effective, but each and every patient is different. So, each and every patient, the mode of treatment protocols, the mode of these physiotherapy protocols is different, and that is compulsory you have to follow them. Just only one thing, the time I think it is, the patients are waiting till now. See,
Yes.
till now they are waiting for my consultation. I am taking class in my. I'm not saying about mostly myself because almost all the conditions I am treating. As a physiotherapy teacher, I am treating almost all the conditions from the gynecology view. You can see a lot of paper presentation in my published articles are there. So in gynecology cases, any kind of infertility I'm treating. And so if you know the medicine very well, if you know the medicines very well and the way of diagnosis, so pure Ayurveda will give 100% result. Pure Ayurveda. And also, one thing I want to say that I'm not using any kind of mineral preparations. Even Yogaraj Guru, I'm not using. I'm using Trayodasha group to some extent. Google only is the mineral, and not using any kind of this mercury preparations, this sulfur preparations, etc. I'm not using any kind of this Vadakajam, etc. Like, and the medicines, the patents which is coming from any part of India, maybe it's in North India or South India, I am not using it. That this Dr. Anjita knows that I am not using any kind of this mineral preparation because continuous use of mineral preparation leads to some issues. And also, if a drug I am giving and giving sudden result, and it is if it is not a sustained result, I will stop that medicine because it contains some modern medicine. So it is not necessary to give our medicine. If a medicine giving prolonged result, that sustained result, I will continue to treat that medicine. So there is now you will get patients. No problem for that, and do stick on to Ayurvedic principles and Ayurvedic style of management because this kind of any kind of rotator cuff tear, this semi-cerebral management, all are having fights with me, and the patient dedicated fights with me. A lot of disease conditions I am treating PCOD, etc. The sites are there for the what the patient has to do. Sites are there, and also that can be treated very well. Oligospermia, azoospermia condition I am treating, and these are the and so much these things I am just I will show that all these things are there in my computer. You can see that folders are there. My new experience collection, relapse syndrome, Marfan syndrome, other sclerosis, mastered bond. This is the mastered bond osteoporosis. Not osteoporosis, osteomyelitis, fibroadenoma, then gastric ulcer, then Hailey disease, infarction cases, now Greenbach disease, then cellulitis problem, leukoderma, all these conditions, this alopecia areata, myofascial pain syndrome, myxoma cases. You can see that all these cases, Takayasu arthritis, then sarcoidosis, then glioma cases, all these cases that I am, trauma of avian, vascular necrosis. So these are the things that I am treating. Myelopathy case I am treating, Takayasu arthritis, thrombophlebitis, you can see, then osteomyelitis cases, venous ulcer. All this I am treating very well and getting the patient transfer. So
Yes.
we will get results. Definitely we will get results. Only thing is that first the Acharya says that Apta Vakyam Satra, Apta Bharta Vakta. So these are things. It's a believe in Ayurveda and practice Ayurveda. Definitely will get results. The Marfan syndrome, anti-CCP, SVLTR, ADHD, all these things I am managing without Ayurvedic treatment. Diabetic retinopathy. Come to a lot of people talk about this.
Okay, thank you, sir. From this presentation, it is very evident. It is very clearly evident that how much confidence sir is in treating. That sir has told that with internal medications itself, Ayurveda can make wonders. Only the main thing is you have to believe in Ayurveda. Okay, thank you, sir. Thank you so much, sir. We know that in spite of your busy schedule, in just one phone call, you have agreed for this section, sir. And our students has had got a lot of informations, and I'm sure that with this presentation, our students got much confidence in treating merely Ayurveda. So thank you for this section, sir. Now I will invite our HOD,
Professor
Professor
and
and
HOD,
HOD,
Dr.
Dr.
Banani
Banani
Das,
Das,
for
for
the
the
vote
vote
of
of
thanks.
thanks. Over to you, madam.
Thank you. Thank you, Dr. Anjida. It is an honor to me the opportunity to express my appreciations to all the dignitaries present today in the webinar. I am grateful to the esteemed delegates of the webinar for their presence and efforts to make this event a great success. I extend my sincere thanks to our Honorable Chairman, Sir, Dr. Sailendra Jadhav, and Director Madam Dr. Sunita Yadav, who gives motivation to us always. I pay my heartily thanks to our chief guest, Dr. T.V. Srini sir, for taking time from his busy schedule to be with us. Your each word from clinical experience is very much helpful for our participants as well as our students and increase their knowledge. Special thanks gives to our principal sir, Dr. Manjunath NS, for his unwavering support for making this webinar successful. Also a thanks given to our vice principal sir, Dr. Tentu Rambabu, for his unconditional support for the successful webinar. My gratitude also goes to Dr. Pritimoy Sao and Dr. Anjida S. Kabir for their efforts to a successful webinar. I must also acknowledge the organizing team for their hard work in the lead up to this webinar. I extend my congratulations to all the participants for their active involvement. Thank you once again to everyone for making this event a great success. Thanks to all.
Okay, thank you, madam.
Thank you
Now,
for your extra one thing. Only one thing is that just you people, we people. I am not saying you people. We people have to propagate a real Ayurveda because real Ayurveda will give fantastic result. And don't go for this mimicking modern medicine. Can do the investigation, any investigation. You can do the MRI, CT, because these are invented by research, invented by scientists. You can do the investigation and find out the disease and coming to our science. And then we quantify the science into Vada, Pitta, and Kapha. These are the physiological functions in our body, not anatomical functions. Whenever we are correcting the physiology, the alert enchant correct the anatomical functions also, definitely. And you can show to the patient, to the public, to the open world that by before and after study. You can do the if ESR and CRP is there, do the investigation. After that, you have to do the ESR and CRP. Let's show that CRP is 100 there, and after treatment, turn to normal. If the CCP is anti-CCP there, you can do that. If free lambda, Africa, multiple myeloma, do that before study and after study. So Ayurveda is very good science, and if you will give very good result. Only one thing is you get confidence. And Anjita is also my student there 3 years, and she had taken I think she has published an article in a journal also about the research studies. And it is there in oligospermia, and very good result they have given. So we people, it's a Rasayatra Parijarapak, because Parijarapak people know more about this medicine. So we can definitely treat the condition. Only the thing is that you have to know the diagnosis and should be update about the modern diagnosis protocols and the modern medicine also. It's very effective, that will be very helpful for us also. Because I am very useful to modern medicine also. I know that because my friends are there, my benchmates are modern doctors. So I am and I know the modern medicine also, but I will not write any modern medicine. But I know that medicine and its side effect and effect also. And that means up-to-date medicine. And I think that Anjita knows that. So these are things you have to follow. So thank you, all of you. That also they have taken leave today for taking these 2 classes. I have already only one Germany class and the third class. So thank you for your patient listening. It is started by 7. Now it is come to 8:30. Thank you all for your patient listening. If any doubt, you can ask to Dr. Anjita, and he's a very good student of myself and very good person. You can ask question also. Yeah. Okay. Thank you.
Okay, thank you, sir. Thank you. So, with this, we have come to an end. Now, we will have the national anthem. With this, we will end this section.